following podcast that you're about to listen to is from Antonio the Mayor. Antonio, D-A-M-A-Y-O-R, the Mayor. And you can reach me by signing on to Anchor FM, Anchor.fm, and just look for Antonio-J-Tim. That's Anchor FM Radio, Antonio-J-Tim. I'm just a click away from you. The podcast that's following is called Don't Shake Me Up Part 2, the intersection between the Black community and mental health. Today's podcast is brought to you by A Craft Away. That's A Craft Away, KRAFT.com, where you can find items for the inside and the outside of your home to decorate it with love and creativity from the owner herself, Katrina Renee. Craft Away can also be found on Instagram and Facebook, so pay them a visit. Look on there and find something to decorate your home by finding a new flair to complement the beauty that your home already has. What happens at the intersection where mental health and the Black community meet? While the issue of being Black in America may have its setbacks, when you add on one's mental health, it can become a tremendous problem in the community in which we live. Now, add on when one has to experience racism and discrimination and inequality. Add all that on to the fact that you're Black, being treated or perceived as less than average, less than normal because of the color of your skin, and that can be stressful and traumatizing. According to the Health and Human Services of Minority Mental Health, Black adults in the U.S. are more than likely than white adults to report persistent stressful situation, emotional distress, such as sadness, hopelessness, and a feeling like everything is an effort. Did you know that only 1 in 3 adults, Black adults, who need mental health care receive it, according to the American Psychiatric Association? I too have had my own mental health struggles. I've struggled many a times with depression, anxiety, and some of that what we call hopelessness. I too have struggled with it. But when I found out, it wasn't a reason to struggle because I got over the barriers that were blocking me and tried to get past the stigma that was associated with mental health that some of us face. We also face distrust in the healthcare system. We have a lack of providers with diverse or racial ethnic backgrounds. We just don't have them when it comes to mental health, not as much. And we want to get someone that can relate to us, we feel that can relate to us or understand us as an African American race. Others have faced, insurance problems or lack of insurance, underinsurance, and just feel that the process of going through all of this for mental health is going to be costly and don't want to pay the cost. We can see when we have to have something done on our heart, on our lungs, on our kidneys, but we can't see it visually. We don't think about it when it has to be done to our brain. That's an organ also. And when I say your brain, I'm talking about your mind. We have to deal with that organ just as much as any other organ. May be the most important organ that you have, your heart and your brain, but your mind, which allows you to think, which allows you to conceive things, make judgments, good or bad, that's your brain. Why not take care of it? The same way you take care of a sore toe or a broken arm or upset stomach. Why not take care of your mind when you know that things are not going as they should be going? You're not feeling the way you think you should be feeling. You're not thinking the way you should be thinking. You're feeling depressed. You're feeling anxiety. anxious just all the time and feeling a hopelessness all the time, you may want to get that checked out. You may want to get a professional help. What's the problem with getting professional help? Well, a lot of times it can be a lack of trust. That distrust gets us a lot of time when we don't trust the healthcare system. And we don't trust, we may trust the healthcare system when it comes to a broken arm or a leg or, diabetes. But when it comes to someone telling us what's going on in our head, we don't need that. I got the church for that. That's what we'll say a lot of time. Which is good. It's good to believe in God. But we believe in God for a lot of things with our health. But we don't go to God when it comes to our mental health. One could be shunned away from the church when he says, I'm depressed. That's going to lead into a whole nother service, a whole nother issue of prayer lines and everything else, laying on the hands. You say, I'm depressed or I'm just anxious. They tell you to calm down. Think about the Lord. Think about the goodness of the Lord. Read your Bible. Go pray. We hear that a lot of times when we say we're feeling a certain way. Go pray. The preacher tell you to pray. But if you tell the preacher, oh, I got a feeling in my back I can't get rid of, come on up with that oil. Let me lay hands on you, brother. But why not lay hands on me when I can't think right? Why not lay hands on me when I'm hurting? I'm hurting in my mind. I can't pull myself out of this rut. And again, I say the church is important, but we got to be well-rounded. The church have to understand what's going on in the black community and mental health. Because fellowship is good. Fellowship is excellent. Fellowshipping with people brings us together. Look at this pandemic, how we've been separated. I spent plenty of times at home watching the services and watching church online, but it's nothing like being with people and hugging and high-fiving and touch your neighbor 3 times and look at somebody and say, it's nothing like that. It makes you feel good. So we have these people who have been in the house for so long, been away from church, and don't know how to get back to church because their mind is telling them one thing and their heart is feeling another thing. So let's deal with the mind. Let's deal with the troubles that's going on with us. Mental health is mentioned in the Bible. If you really look at your scripture, look at Psalm 34:17 when it says, when the righteous cry for help, the Lord hears and delivers them out of all their trouble. The Lord is near to them of a broken heart and saves the crushed in spirit. That's the ESV version. The broken heart and save the crushed in spirit. That's mental health that's needed. I understand God wants you to have a sound mind. The Bible tells us to not be conformed to this world, but be transformed by the renewing of our mind. But some of us don't have the faith to get to that point, and we need someone to talk to. The preacher may be quick to lay hands and have you run around the church 10 times and pour oil on you. But sometimes these people just need somebody to talk to. Whether it be a psychiatrist or it be the reverend, doctor, bishop, faith leader, themselves need someone to just sit down and listen in a non-judgmental way. And this is something we always look for in the black community. Let me talk to the preacher. Let me go to church. And I'm thankful for that. But when we can't get to the church, we need someone to talk to. Get to that person, whether it be your close friend, your neighbor, or someone that you confide in. Let them know, hey, look, I'm having bad thoughts. Sometimes I think I want to kill myself. Sometimes I feel like I just can't pull myself together, my thoughts together. I've been depressed for 4 days. I haven't did this for 5 days. I haven't pulled myself out of this rut. What can I do? Talk to these people. Talk to a professional. Mental health is not guaranteed any more than physical health is. And like the body, the mind can get sick or injured. And I'm not just saying this all just because of church and your faith. I have faith. I go to church. I believe in God and everything. But I also know that us as African American people, especially men, are reluctant to get help when needed. We're reluctant to even ask the church for help, to tell, us to come into lines in church or the call in the church or ask the preacher for help. We're reluctant to do that. We don't want to do that. It seems embarrassing as an African-American man. But we got to get past the stigma of worrying about how people look at us. We've already been discounted in a lot of areas. Don't discount ourselves. Don't discount yourself as not being able to achieve something. But think of yourself as being strong and powerful. So the black community has to face mental health head on. Too many times I grew up and too many times I've seen growing up in Chicago, people who we call crazy or drunks, African American people in my neighborhood that were just drunks laying under the porch sleeping and walking around the neighborhood and old clothes and talking to themselves, and we just call them crazy, not knowing that there is help for this. Because we haven't been given the spirit of fear, but God wants you to have a sound mind. Your wife wants you to have a sound mind. Your children want you to have a sound mind. Your employers and employees, they want you to have a sound mind. And during this latest pandemic, we found out that, you can find help in so many places now. I mean, it's not hard. It makes it a little bit easier. One good thing about the pandemic, it gave us the opportunity to use telehealth where you can talk to a therapist. You're in Chicago, your therapist can be in New York or Detroit or California or something like that. You can find what you need because of telehealth. And because of being able to do therapy over Zoom, Skype, or some of the other platforms that they have that they use for therapy. So again, we think about the intersection where the community meets mental health. The black community meets mental health. And we think about what goes on at that intersection. Do we join together or do we take a bypass? Especially as African American, especially us African American men. What do we do there? Do we continue to be shooken up? Do we continue to let something shake us up? Shake us up, just like I talked about before, that can of soda. If you shake up a can of soda and you pop that lid or you turn the cap and you open it, it's going to explode. And we continue to let things shake us up without receiving the simple help we need. The help is simple. It's simple. It's just a matter of pride a lot of times. Matter of our own African American male strong pride. Do you know how long I even went without even mentioning to my own wife that I was seeing a therapist? Do you know? It was a long time because of the stigma, that embarrassment that, hey, I'm not a strong man if I have to talk to somebody about my problems. Besides God or the preacher or my best friend, if I say I'm using a therapist, a psychiatrist or something, people thinking, hey, something wrong with him. If I'm using a psychologist and psychiatrist for medication. If I'm using a psychologist, people thinking, hey, something's wrong with him. We feel embarrassed. We feel belittled because we have to say, hey, I need help. If I can get anything over to you, I'm going to tell you, get away from being ashamed. If I can get anything into your mind, I would say, get away from being ashamed. We don't have time for this, men. We don't have time for this, sisters. What we do have time is for seeking out help that we need. If you're experiencing anxiety and depression, thoughts of suicide, this is Mental Health Awareness Month. Take advantage of it. It's a lot of resources out there. And like I said, I myself had to put down my pride, put down all the feelings that I had of worrying about what someone else was going to think, that I'm spilling my guts to. What is their response going to be to what I'm saying and the information that I'm giving them about my life? Would they be in shock and say, oh, wow, all this is happening to you, this is going on with you? You have plenty of time. If you're not comfortable, with the person you talk to, seek out another person. It's not any slap in the face to a therapist if you say, hey, I don't think we're a good match. I remember watching episode of This Is Us when Randall was looking for a therapist. And that's what he did. He finally came to the conclusion that, hey, I like this guy right here. It'll work. You're not a good match for me. No hard feelings. I like you as a person, but as a therapist, we cannot connect. And I hope you understand why I'm saying this and why I'm feeling this way. Just tell him that. Your mental health is at risk, so be honest with him. And in that episode, that's what he did. He was honest with the person who he was already seeing and let him know. And we're not going to harp on that and go back and forth about that episode. But I want to talk about real life episodes that happen in you and in I. And it happens. It happens to me. I've had to deal with anger outbursts or depression, just like I said earlier. And at first, I thought I can handle these things on my own. I'm just going through a little something. But when it continued day after day, then you know something is wrong. When you keep having episodes at work and at home and at church or wherever you may be, you know you got to get something done. You know, if we were having the same problem, like say you're having the same problem with your foot or your toe or your knee, and it keeps aching. You know how you say it, I got to get to the doctor sooner or later. I got to get this checked out on sooner or later. And you keep putting it off till you find out it's a worse problem than it was at first. Don't put your mental health off and find out, man, I'm a little bit worse than I thought I was. I really need help now. Or you put it off until something happens way out of line with you, or you do something way out of line and you just blow up and you just lose it. Don't wait for that to happen either. Okay? Take it from me. Take my advice, not because of the profession that I'm in, but take my advice because of what I experienced myself and what I'm trying to let you know. These are things that we experience as black men, but we have too much pride to go and say, hey, help me. In the black community and other communities of color, it's more than likely that we will experience social disparities such as exclusion, health, education, social economics. But these disparities can contribute to a worsened mental health, or the outcome can be worse because we have already experienced that coming to the crossroad there with mental health in the black community, and we've been suffering so much in the community that we feel like that I'm at my wit's end and I can't take any more. And we get to the point that just something drastic happened. Then we get to the point that something happens that we cannot control on our own. And some of this is our own people. I mean, our own people may frown upon us for receiving mental health treatment because of the community we live in, and everything is so close-knit and tight. And when something like this happens to one of our loved ones, they can be frowned upon or looked down on. So don't let the barriers or the stigmas that are associated with mental health, such as distrust, the lack of providers, and the lack of cultural competent providers also get in your way. Don't even let the financial part get in your way. There's plenty of places that give you free mental health. Because believe it or not, only 1 out of 3 African Americans who need mental health receive the help that they need. Even though the rate of mental illness in African Americans are similar to those of the general population, however, disparities exist in regards to mental health care services for African Americans because we often receive poor health care and a lack of access to cultural competent providers. However, compared to non-Hispanic whites, African Americans with any mental illness have lower rate of any other race of receiving the services they should receive because of disparities in their community. Now, we receiving the prescription drugs and the outpatient services at a higher rate, but we do receive the inpatient treatment at a higher rate. Meaning we usually wait till it gets to the crisis mode before we'll say, hey, look, something is wrong. Or we don't even say something is wrong. We just get it at the crisis state, and they're just acting out. They're violent. They're a violent offender. They're a violent person, or something is wrong with them. You know, we wait till it gets to there. I mean, you think about it. Look at George Floyd. What did his own friends say? Hey, something is wrong with him in the head. You remember him pointing to his head in the videos that they showed? Something's wrong with him. At that point, the police could have been triggered to think, hey, maybe I need a professional to help me with this. Maybe I'd approach this in a different way. Instead of approaching him with guns drawn and trying to force him into a car when he say he's claustrophobic and he has an anxiety problem, you're forcing him to do what he says don't do is what you're looking at. But actually, he's looking at that you're forcing me into a situation that's going to cause me to be shaken up and explode. So don't wait till it gets to the crisis level before you receive care, brothers and sisters. Don't wait for that. People of America, don't wait till it gets to the crisis state to where you say, I need help. I need help. I need help. There's help out there. There's help out there for you, and there's help for me out there before it gets to the state that is so bad. Get help when you start feeling these things. Even if you just think this, it doesn't hurt to talk to someone. What's going on with you? Thank you for having a listening ear. I'm going to leave a few numbers with you and a few different agencies that can help you just in case you want to receive help or just in case you come to the point that you want to call someone. Thank you very much. It has been a pleasure being here with you. Thank you.
The number to call is 1-800-273-TALK or 1-800-273-8255. National Suicide Prevention Lifeline is 1-800-SUICIDE. Again, that's 1-800-SUICIDE. The crisis text line is text HELLO to 741-741. Again, that's crisis text line. Text HELLO to 74174. Crisis hotline for teens and kids is 1-877-968-8491, or you can text teen to teen at 839-863. The ages are between 11 and 21 years of age.
Thank you for listening. I appreciate your support by lending me your ear. Please go and subscribe, follow, and share my podcast. For questions and comments, I can be reached at bigdog0862@me.com. That's bigdog0862@me.com. Tune in weekly for something interesting and exciting. This is Antonio the Mayor, Tony the Mayor, signing off and saying thank you. And remember, you can reach me also on Facebook at Tony the Mayor. Tony the Mayor, DAMAYOR. And you can also reach me on Instagram, TheMayor0862. The Mayor, DAMAYOR 0862. So I'll be looking to hear from you next time. And remember, call me. Send me a message because everyone has a story to tell of experience, strength, and hope. And I want to hear your story. Thank you again.